Thyroid diseases. Thyroid gland, which is located at the base of the neck, it's right here, produces a hormone called thyroid hormone. The thyroid hormone, the thyroid hormone is also called thyroxine. So thyroxine is the hormone that is released from this gland. It's the main hormone. There is another hormone comes from this gland as well, but we don't talk about that now. The thyroxine has two versions. One version is called T3, one version is called T4. And that's based on, both of them do the same action, based on the number of iodine inside the structure of T3 or T4. Both of them are working the same. One is more active, one is less active. So if you hear T3, T4, that's the same as thyroxine. Both of them are the same. And then they are released from thyroid gland. But what is the action of this hormone? This hormone is doing something very, very important in your body. Is controlling the rate of metabolism. What does that mean? It means, metabolism means how fast you are burning food and make energy. Because you need to burn food and produce energy. When you eat food, you burn it, make energy, you use that energy for daily activity. Thyroxine will determine how fast you do that. If you have too much thyroxine, you burn the food faster, so you have much more energy available for your daily life. If you don't have thyroxine, whatever food you eat, you don't burn it. You will store it and you're going to gain weight. See, this is the story of thyroxine. So thyroxine, having more thyroxine will increase to burn food. So whatever you eat, you use it and then make energy. This energy is used for walking, for running, for using in the brain, whatever. Or sweating, getting hot. And if you don't have thyroxine, opposite. We usually have normal amount of thyroxine in our daily activity, most of us, okay? But the gland might become dysfunctional, meaning that produces too much thyroxine or produces a little bit thyroxine. So if more than normal or less than normal. If thyroxine is produced a lot, we call the disease hyperthyroidism. If thyroxine is produced less than normal amount that we need, we call it hypothyroidism. Based on the actions of thyroxine, I just told you, you can even guess what are the signs or symptoms or the picture of this patient that you see as a hypothyroidism or you see as a hyperthyroidism. But let's review them quickly. I just want to kill in here. Can I do it? Hyperthyroidism means that you have a lot of thyroxine in your body for so many reasons. When you have extra thyroxine in your body, meaning that you produce too much energy. So based on that, you have signs and symptoms. Meaning what? Meaning this. First of all, you always eat, right? You eat because you always using this food as making energy, changing it to energy. So you eat too much, right? You eat too much, but because you spend this as energy, you lose weight. Wow, such a good thing. Yeah, everyone likes that. To eat, but at the same time lose weight. So these people are very skinny. They eat all the time. But you can say, oh, how about if I have hyperthyroidism that I eat all the time? But it has so many other problems that you really don't want to take only this one piece of it and then just, leave every other parts of it. So because you make too much energy, you always have a lot of sweat. So you're always just hot and sweaty, right? So your body temperature, not body temperature, but you feel always hot. So you are sweating, right? Sweating all the time. So you're always wet. So the other thing is that because you make too much energy, and your heart wants to get rid of this energy, increasing the circulation, so you have increasing the heart rate. So you have these patients, they have always increased heart rate. Because they have increased heart rate, they have something else, we call it palpitation. What is palpitation? Palpitation means they feel their heart beat. If you feel, you know when you run so much, and then when you run and you stop and you feel your heart is beating, that is called palpitation. That is very annoying feeling. When you run is okay, but when you're sitting and watching TV and you feel your heartbeat, that's very annoying. These patients usually don't like it. The other sign and symptom, because they have too much energy, they cannot sleep. So they have lack of sleep, lack of sleep, lack of sleep, or we call it insomnia. Insomnia, lack of sleep. The other thing they have is what else they have? Because they have too much energy, they also have, I forgot, they have anxiety. Because they have so much energy, the heartbeat is fast, they usually have anxiety and stress. These are the major signs and symptoms. There are different diseases might cause hyperthyroidism. If somebody has a tumor inside the thyroid gland, for example, produces too much hormone. One of the most common one is a disease called Graves' disease. Graves' disease is a disease that causes thyroid gland to become hyperactive and produces too much thyroid hormone. People, they have Graves' disease. Usually they have all these signs and symptoms. They also have something very, very distinguished for them, a sign, which is their eyeball is popping out. The eyeball is popping out, and then you see the eyeball is popped out right away when you notice that is called exophthalmia, if you want to know the medical terminology for that. Exo means out, ophthalmia means eyeball. So exophthalmia means eyeball is popping out. So these are the major things you need to know about hyperthyroidism when there is too much energy available in your body. Hypothyroidism is opposite. Meaning what? Meaning that you have a thyroid gland which doesn't produce enough thyroid hormone. As a result, what happens? Everything is happening opposite. It means you don't eat at all, you don't have appetite because you don't make too much energy, you don't need food. As a result, your appetite is what? Is low appetite. You don't eat too much, right? Low appetite. The medical word for low appetite is what? Is anorexia. The word anorexia means what? Means low appetite. So you have low appetite, but even though you don't eat, because whatever you eat, even a little bit, it will store in your body. You don't burn it. You don't use it. As a result, what happens? You gain weight. You gain weight. You see, totally opposite. Here we sweat a lot. Over there, you don't sweat. So the skin is what? It's very dry. Dry skin. The nails are very brittle and fragile. Fragile nails because of dryness. Fragile nails, right? So like that. For the heartbeat, they actually have very slow heartbeat. The slow heartbeat. Another medical terminology I'm going to tell you, the fast heart rate is called tachycardia. It's called tachycardia. It's called tachycardia. Tachycardia with H, tachycardia. And the slow heartbeat is called bradycardia if they ask you in different exams. So the tachycardia, bradycardia. So fast heartbeat, these patients, they have a slow heart. These patients, hyperthyroidism, they have lack of sleep. They cannot sleep. They have anxiety. But here, opposite, they sleep a lot. They sleep a lot. They sleep a lot. And then the opposite to anxiety is depression. These patients, a lot of them fighting with depression. That's hypothyroidism. So these are the major things you have in hypothyroidism. So you need to understand, as a basic medical treatment, if the patient has hypothyroidism, very simple treatment. What is this? We give them thyroid hormone every day. You make pills of thyroid hormone, sometimes chemicals, sometimes you get from animals, and then you eat those pills. You give the pills 1 pill per day, replacing thyroid hormone. So if you see a patient who is every day taking the thyroxine pill, we call it levothyroxine, that's the name of a pill, that means this person had hypothyroidism. We're replacing that thyroid hormone. If someone has hyperthyroidism, there are different ways to treat these patients. Either they give some pills that they suppresses the thyroid gland, or another way as a final treatment or the ultimate treatment for them is this, because sometimes it's difficult to get rid of all these extra thyroid hormones. You know what they do? You know what they do for it? You don't know. You know what they do? They remove the thyroid gland totally. So they make you what? They make you hypothyroidism, artificial hypothyroidism, and then they give you everyday replacement of thyroid hormone. That's much easier to deal with this condition rather than you want to suppress all that extra thyroid hormone every day. That's the choice that so many doctors choose to treat these patients. Very good.